Now, let's tackle it one by one. First is the nursing history. So during the nursing health history, the nurse obtains data about the client's oral hygiene practices. So you are going to ask the patient about his or her practices, including the dental visits, the self-care abilities, and past or current mouth problems. Now, data about the client's oral hygiene help the nurse determine the learning needs and incorporate the client's needs and preferences in the plan of care. So, assessment of the client's self-care abilities determines the amount and type of nursing assistance to provide. Our patients whose hand coordination is impaired, say for example, yung ating mga senior na, no, yung mga old patients natin, so hindi masyado okay yung dexterity na nila, no, when holding a toothbrush, okay? So, medyo mahirapan na yan sila maghawak ng mga ganyan na mga materials. Okay? So, impaired yung kanilang hand coordination. And those patients whose cognitive function is impaired and whose illness alters energy levels and motivation or whose therapy imposes restrictions on activities will need assistance, no, from the nurse. Now, information about the past or current problems alerts the nurse to specific interventions required or referrals that may be necessary. So once again, as nurses, we obtain data about the client's oral hygiene practices, including dental visits. So you ask the patient, kailan yung last nila nagpa-check up, no? Dental check-up. Self-care abilities, kung kaya ba nila, alam ba nila paano mag-toothbrush, tama ba yung kanilang oral care, oral hygiene, and past or current mouth problems. Okay? Now let's go to the physical assessment. So you're going to assess the patient. Dental caries and periodontal disease are the two problems that most frequently affect the teeth. Okay, as you can see sa picture, yan siya, no? May sira ng ngipin and periodontal disease. Both problems are commonly associated with plaque and tartar deposits. So, alam niyo ba ano ibig sabihin ng tartar and plaque? Nakakita na ba kayo niyan? Plaque and tartar?
Yes po, ma'am.
Yes.
Okay. So, yan. Tingnan natin sa picture. Yan yung plaque, no? Healthy tooth. And plaque yan, may nag-start na nag-form ng yellowish, and there is inflammation also. Okay? Nag-start na yan siya, masira ang ngipin ng patient natin or kung sino man may nakita kayong ganito. Kahit sa inyo, no? Lahat tayo naka-experience ng may plaque sa ating ngipin. Okay? So, plaque is an invisible soft film that adheres to the enamel surface of the teeth. So, pwede siya dito or dito sa taas. It consists of, ano kaya? Anong meron sa plaque? Bacteria, molecules of saliva, and remnants of epithelial cells and leukocytes. So, yun pala ang laman ng plaque, no? May bacteria. Okay? Now, ano naman kaya ang itsura ng plaque, ay ng tartar? Next, sa tartar na tayo. So, alam na natin ano yung plaque. For the tartar, as you can see, what's the difference between tartar and plaque? So, when plaque is unchecked, tartar or dental calculus is formed. Okay, like this, oh. So, mag-itim na yan siya dyan or mag-color gray. Tingnan niyo yung ngipin ito na patient. Yan siya. Poor oral hygiene. So, tartar is a visible hard deposit of plaque and dead bacteria that forms at the gum lines. Tartar build-up can alter the fibers that attach the teeth to the gum and eventually disrupt bone tissue. So, pwede siya mag-abot doon sa gums. No? Like ito, oh, tinan nyo ang gum integrity niya. Diba? So, nasira na. So, pwede yan siya mag-extend pa doon sa kaloob-looban. Okay? So, ang hirap, no? Karoon ng plaque, then mag-progress siya to tartar. Now, let's learn about the periodontal disease. So, ito yung mga periodontal disease, iba't ibang klase. It is characterized by gingivitis. So, this is the gingivitis. Now, it is red, swollen gingiva, yung gums ng patient, okay, or ng client. Bleeding, receding gum lines, so nag-bleed yan siya. Okay? And the formation of pockets between the teeth and gums. As you can see, no, yan, may mga pocket niya, no? So, nag-swell na siya. So, this is gingivitis. Okay. In advanced periodontal disease like pyorrhea, yan siya, pyorrhea, ito siya, as you can see sa picture, the teeth are loose and pus is evident when the gums are pressed. So, when you do your assessment, when you press the gums, pus will come out. Okay? Yan yung defining characteristic ng pyorrhea. Okay? So, these are the periodontal disease, including the tooth decay. So, as you can see, the gum disease, there's this healthy gum, and this is the gingivitis and the periodontitis. So, dito naluag na talaga yung kanyang gum, no? Ayan. So, pwede na matanggal ang ngipin yan. Okay, for the assessment interview, how are you going to ask your patient with regards to her oral hygiene? So with the oral hygiene practices, you're going to ask your patient, what are your usual mouth care or denture care practices? In that way, you will know, no, if tama ba yung kanyang practice, ang kanyang hygiene. Now, what oral hygiene products do you routinely use? Are you using mouthwash? What is the type of the toothpaste that you are using? Are you flossing your teeth? Are you using dental floss? Are your dentures clean? No? Is the patient soaking her dentures? So you ask that to your patient. Do you have any loose or sensitive teeth? Do you experience bleeding after brushing or flossing your teeth? So pwede siya indication, no? If ever the patient will answer you na nag-bleed while flossing, so pwede siya because na poor ang kanyang gum integrity, so that may lead to gingivitis also. When was your last dental examination and how often do you see your dentist? Okay, those are the questions for the oral hygiene practices. Now, for the self-care abilities, kaya ba ng pasyente gawin yung mga oral hygiene na yan? So, do you have any problems managing your mouth care? So, maybe the patient is an old patient and hindi na niya kaya. Ngayon, sabi ko na poor na ang kanyang coordination, no? Nahihirapan na mag-brush ng teeth on his or her own. Okay? Then with regards to the past or current mouth problems, have you had or do you have any problems such as bleeding, swollen or reddened gums, ulcerations, no? May mga sores ang kanyang gums, lumps or tooth pain? Okay, meron ng problem. So, you ask that to your patient also. Have your eating patterns changed due to mouth pain or discomfort with chewing? Okay, so yun ang ating assessment. Do you have any questions? Okay, so I think wala na, no? So let's proceed. We're done with the physical assessment. Now we're going to identify the client at risk. So sino ba? So as you can see sa picture yan, sila yung mga clients at risk. So sino ito siya? At risk for developing oral problems. Poor oral health, elderly.
Elderly.
Yes. How about this person na initan? No? He needs water.
Dehydrated person.
Yes, dehydrated person. How about this one? Might be. Okay, nasa ICU, ano yan sila, tas tulog na tulog, hindi magising, GCS3. Comatose patient, okay? So sabi dito, certain clients are prone to oral problems because of an inability to maintain oral hygiene. Among these are clients who are older, seriously ill, confused, comatose, depressed, or dehydrated. So sila yung client at risk for poor oral health. Now, effective oral hygiene requires fine motor skills, adequate vision, and syempre motivation. So poor oral health is a common problem among older adults in general. Okay, common siya sa mga elderly. It can be more of a problem for an older adult who has cognitive, no, may impairment sila, cognitive impairment, visual or physical impairment. Okay, critically ill patients, like ito siya, can experience complications that may lead to ventilator-associated pneumonia. Ma'am, bakit magkaroon ng pneumonia, ventilator-assisted? No, kasi wala nga, hindi nila kayang to do oral hygiene, oral care by themselves. No, and then the bacteria will lodge here, no? Pwede dito sa ventilator niya, yan, in the long run, and then will go inside the patient's lungs, no? A longer hospital stay. So, increased cost of care also, and even death, no, if oral assessment and care are not properly performed. So, oral care is very important to those patients na comatose or unconscious, aren't able to care for themselves. Okay? Now, in this picture, anong mapansin ninyo? Ito, at risk ba ito sila? What
Yes,
patient
ma'am.
to? Anong nangyari sa patient nito? Meron siyang
NGT po.
NGT. And this patient, naka-oxygen
Mask.
therapy. Okay, naka-oxygen mask siya. People with nasogastric tubes or NGT or who are receiving oxygen are likely to develop dry oral mucous membranes. No, makadry siya ng mucous membranes doon sa loob. Okay, sa nasopharynx, especially if they breathe through their mouth. Okay? Ano pa? Ito, ang patient na ito, anong nangyari sa kanya? Meron siyang oral, ang tawag yan, inoperahan, oral surgery or jaw surgery. Ayan, oral surgery ang sa kabila. So clients who have had oral or jaw surgery must have meticulous oral hygiene care to prevent the development of infections. Okay? So let's answer, true or false. Healthy appearing individuals too may be at risk. True or false?
True, ma'am. Anyone
True,
can get
ma'am.
that risk, ma'am.
True, ma'am.
Okay, very good. True. Sige, tama. True. High-risk variables such as lack of knowledge. Kahit healthy ka pa pero wala kang alam, no? Lack of knowledge. Inadequate nutrition. Lack of money or insurance for dental care. Excessive intake of refined sugars. Mahilig ka ng matatamis. And family history of periodontal disease also need to be identified. Kahit pa healthy ang body mass index mo, normal ang iyong weight, pero wala ka namang knowledge, wala kang pera, no, para sa insurance, magpa-check up. So, you may be at risk pa rin. Healthy individuals, at risk pa rin sila. Okay, another one, true or false? Older adults may also be at risk.
True, ma'am.
True, ma'am.
Why? Why? Bakit kaya? Why do you say so? Bakit true? Bakit at risk ang mga older adults?
Some
Usahan
older adults, ma'am, kaya.
Tamad sila mag
Hygiene nila,
oral
ma'am.
hygiene.
Tamad sila mag-hygiene or hindi na masyado na maka-brush ng teeth? Okay, maybe. So, some older adults may also be at risk. For example, those who choose salty and enamel-eroding sugary foods because of a decline in their number of taste buds. As we grow old, meron kasi tayong tinatawag na wear and tear theory. No? Pag tumatanda na tayo, so decrease na ang kanyang taste, no? Ang sense of taste niya, yung taste buds niya, nag-decline na yung function. So, kaya nga mapansin nyo, for example, na sa amin sa bahay, yung lola ko ang nagluto, siya ang nagluto ng tinolang manok, pero grabe kaparat. Ang kadami niyang asin na nilagay kasi pagtikim niya, wala daw lasa. So, pagtikim din namin, sobra nakaparat. No? So, that's the explanation na nag-decline na yung kanilang number ng taste buds nila. So, they are also at risk talaga. No? The decreased saliva production din sa kanila. Nag-decrease ang production ng saliva, which produces a dry mouth. And thinning of the oral mucosa is another factor. Okay? Yung ibang matatanda, mahilig din talaga kumain ng mga sugary foods, lalo na tuloy masira ang kanilang ngipin. Okay? So, true ang answer. Ano pa bang iba? No, ito sa first picture, ito siya. Wala siya, hindi siya nag-inom ng tubig. At risk ba ito siya? Poor fluid intake. At
Yes,
risk?
ma'am.
Yes,
Repeated
ma'am.
hydration, ma'am.
Okay, pareho lang kanina. How about the second picture, the girl in your right? This one? At risk ba? Anong tawag
Yes.
nito?
Yes,
Because
ma'am.
Smoker.
putin niya heavy smoke.
Okay, heavy smoking. No, can cause dry mouth also. Oh, nicotine can lodge in your teeth. Diba? Okay, how about this one? This guy. Anong ginagawa niya?
Alcoholic. Yes.
Nag-iinom mo.
Okay, nainom mo, alcohol use. Poor fluid intake, in this first picture, heavy smoking, alcohol use, high salt intake, anxiety, and many medications can worsen dry mouth. Okay, this can worsen dry mouth. Ayan siya. Too much salt, no? High salt intake, makakos yan siya ng dry mouth. And the patient with anxiety, fear of the unknown, pumunta sa emergency room, hindi niya alam, no? Ano nangyari sa kanya. Fast breathing, high pulse rate, high respiratory rate. Yan ang mga signs and symptoms. High BP ng anxiety, no? That can cause dry mouth or worsen dry mouth. Can also impair the oral hygiene or oral health of the patient. And also medications. Okay? So ano ba yung mga medications? Examples can cause dryness of the mouth, yung mga diuretics. Diuretics is yung mga pampaihi ng mga medications. Laxatives, mga pampatae, if used excessively, okay, can cause dry mouth. And tranquilizers such as diazepam or Valium. Okay, pampakalma and pampawala ng seizures. Yan silang mga medications na maka-worsen ng dry mouth. So ito sa picture na ito, anong napansin ninyo? Radiotherapy in head and neck cancer. So kung may patient ka na inalagaan sa ward na merong head and neck cancer, kamusta naman ang kanilang oral health niyan? So they may have permanent damage sa salivary gland nila. Okay, so yan talaga ang mahirap, no? Kapag nag-radiation therapy, may complications tayo. No, they possibility of having permanent damage sa salivary glands. So clients who are receiving or have received radiation or radiation treatments to the head and neck may have permanent damage, and this results in a very dry mouth kasi wala na nga salivary gland na damage na nga. So sino pa mag-produce ng saliva? No? And can often be treated by providing, paano siya matreat? Thick liquid called artificial saliva. So we can give them this example, e-saliva dry mouth spray. So available ito siya. I-reseta yan ni doc. Usually sa mga pasyente na nag-undergo ng radiation therapy sa head and neck. Okay? Some clients prefer to just sip on liquids to moisten their mouth. And radiation can also cause damage to teeth and the jaw structure, with actual damage occurring years after the radiation. Hindi naman agad-agad, unti-unti lang. Okay, yan siya ang radiation therapy. Yan lang ang mahirap dyan na complication. Okay, now we are going to answer these common problems in the mouth. Let's try to answer this one. So let's see from here, 1, 2, 3, 4, 5, 6, 7, 8. So i-identify natin kung saan sila dito. For the cracking of lips, so you can search the internet. Saan kaya dito ang cracking of lips? Let's define some terms. Number 1, this one, cracking of lips. Parotitis, stomatitis, warts, dental caries, cheilosis, periodontal disease, gingivitis, glossitis, or halitosis. Okay, you search the internet. Ano kaya? No, this is just part of the periodontal disease. No, kaya meron siyang dash dyan. This is part of it. So, ano kaya? Cracking of lips is, at least meron tayong malaman, no? Sige, anyone can answer? Cracking of lips is cheilosis. Okay? So, sige lang. Cheilosis ang answer, okay? How about bad breath? What is the medical term?
Halitosis.
Yes, halitosis. How about the inflammation of the gums? Yung kanina, na in-explain ko na nag-red yung gums na.
Glossitis.
No, sa gums siya, no?
Gingivitis.
Gingivitis. Then the inflammation of the tongue is the
Glossitis.
glossitis. No? Glossitis. Meaning ng itis is inflammation ha. Tandaan niyo yan. Itis, inflammation. Okay? Gums appear spongy and bleeding. Ano yan siya? Nag-bleed, may reddened excoriated mucosa, may dryness of the buccal mucosa. Ano yan siya?
Bite.
Letter P ang nag-start. Letter P. Periodontal. Okay, yan siya. Ito, mahirap ito. Accumulation of foul matter. May food, microorganisms, and epithelial elements in
Dental
the mouth.
caries.
Ano kaya?
Dental
Are you
caries.
sure? Mahirap to class. Okay, swords ang tawag niyan. Okay? Sige lang, ipakita ko na picture later para alam natin. No? Assessment ito parts of physical assessment natin. At least alam natin, first year pa lang, alam natin anong mga meaning nito. Inflammation of the parotid salivary glands. Gibayuok ang pasyente. In Tagalog, gibayuok, Bisaya, ano ba?
Parotitis mo.
Parotitis, okay. Very good. Inflammation of the oral mucosa.
Stomatitis.
Luas ang pasyente, may mouth sores. That's stomatitis, ha? Hindi ibig sabihin stomach, no? Hindi sa stomach yan, ha? Stomatitis, mouth sores or mouth ulcers. So, teeth have darkened areas may be painful.
Dental
Last
caries.
one. Okay, dark no, nag-itim na yung ngipin. Dental caries. Okay? So, ngayon, alam na natin yung mga common problems in the mouth. So, magaling na tayo sa assessment, no? Pagdating sa oral care sa patient. Okay? So, ayan na. Ito na yung common problems of the mouth. Ano yung nursing implication? Ano yung gagawin natin? So, kanina, halitosis, bad breath. So, anong gawin natin? We're going to teach or provide regular oral hygiene sa pasyente. Glossitis, this is the inflammation of the tongue. So, same pa rin ang nursing implication, teach or provide oral hygiene care. So, tingnan nyo sa picture, may mga different types of glossitis, no? This is the normal tongue. Then, this one is desquamative glossitis, no? May desquamation sa kanyang tongue. Okay? May puti-puti na patches dyan. Then, folded glossitis. So, makita nyo, pag open ng mouth, may giring-giring or zigzag dyan. Okay? Sa kanyang integrity ng tongue. Then, candida glossitis. Candida glossitis is the infection in the tongue due to the candida albicans. No? Yeast infection. Yan siya. No? Parang ito. Okay? Oral thrush. And then ulcerative glossitis, meron siyang mga ulcers sa kanyang tongue. Ito, phlegmonomus glossitis, herpes. So may herpes, no? May mga ulcers sa kanyang tongue. Herpes is forever na class, ha? Kapag may herpes ka, forever na. Pero magtago lang yan siya sa nerve cell. Then mag-appear lang yan siya in the future kung magbaba ang iyong immune system. Okay, so mahirap ang herpes. Kaya forever na yan meron sa iyo. Pero matreat ka naman, symptomatic. Mawala yung symptoms din. Pag magkaroon ka naman ng sakit, magbaba yung system mo, mag-appear na naman yan siya ulit. Nagatago lang yan sila sa nerve cell, ang virus. Okay, so kahirap magkaroon ng herpes. Next is the median rhomboid glossitis. So I think this is called the rhomboid because of the shape, no? Na meron siya sa kanyang tongue itong inverted triangle. Then atrophic glossitis, so nagliit ng kanyang tongue, atrophic na siya. Okay, so those are the nursing implications. Same pa din, provide regular oral hygiene, yun lang ating treatment dyan. Then again, gingivitis, inflammation of the gums. No, may redness, mapansin nyo yan upon your assessment, may redness dito sa kanyang gums. No? So, tignan nyo rin inyong gums, malay nyo, no? So, dapat nag-inom kayo ng vitamin C, nag-take kayo ng vitamin C para ma-prevent ang gingivitis. Okay? Then, periodontal disease, ayan siya. No, mag-abot na siya sa bone, doon sa loob, kaloob-looban. Okay, gums appear spongy. Yan, pag-assess mo, pag i-ano mo siya ng tongue depressor or ng cotton buds, pag ano mo sa gums, medyo spongy siya and nag-bleed din like gingivitis. Okay, what else? So sa chelosis, cracking of lips. Okay, nag-crack lalo na dito sa side. So kung may chelosis, kulang ng vitamin B complex, instruct the patient to take vitamin B complex. No, para tsaka to drink lots of fluid. No, lubricate the lips, the use of antimicrobial ointment to prevent infection. No, kailangan i-lubricate ang lips. Yan siya. Bakit ba kailangan ng antimicrobial ointment? Kasi open na, may open wound na, may sore na siya. So, mouth is the dirtiest part of our body. That's why we're going to put ointment dyan para ma-prevent ang infection. No? Kasi kahit ano lang pinapasok natin sa mouth natin, kaya siya ang pinaka-dirtiest part. Okay? Next is the dental caries. Yan, may makita kayong itim-itim. No? Tooth decay. Teeth have darkened areas and may be painful. No? Advise client to see a dentist. Sila lang yung solusyon dyan. Yan. Then for the swords, ito yung accumulation of foul matter. May naiwan yan. Kunyari, ang ngipin mo sira, may tooth decay ka, and may naiwan na mga pagkain, may food remnants doon. Okay? Parang same lang din siya sa dental caries. No? So, teach or provide regular cleaning. Pwede magpa-cleaning ka sa doctor para mawala yung swords mo. Then stomatitis, no? Sa oral mucosa, merong ulceration or may sores. There's inflammation. You teach or provide regular cleaning also. Then, this one, parotitis or yung mumps caused by a virus. No, there's inflammation of the parotid salivary glands. So, you have to teach or provide oral hygiene. Okay? So, okay ba? May natutunan ba kayo? Okay na bang assessment natin?
Yes, ma'am.
Okay. Mas better no na may mga pictures. Mas madali nating maintindihan. Okay, now we're done with the assessment. Now, we're going to go with the diagnosing. No? Nursing process pa rin tayo, ha? So, two nursing diagnoses that related to problems with oral hygiene and the oral cavity are, ano daw mga nursing diagnosis natin ito? Altered oral mucous membranes, ha? Sa NCP, ha? Ito yung gawin natin. Lack of knowledge, yan sila ang top 2 nursing diagnosis. So, signs and symptoms of altered oral mucous membranes can include a coated tongue, dry mouth. Other term for dry mouth is serostomia, or serostomia pala rather. Halitosis, yung bad breath. Gingival hyperplasia, meaning namaga, no? Nagkaroon ng hyperplasia yung kanyang tongue. Difficulty eating, hirapan magkain, and oral pain or discomfort, and oral lesions or ulcers. So yan sila yung ating mga defining characteristics or signs and symptoms. Yan ang makita natin sa pasyente so we can diagnose them with altered oral mucous membrane. Okay? So this may be the result of inadequate oral hygiene, no, related to physical injury or drying effect like mouth breathing. Diba? Kapag nag-breathe ka sa mouth mo, mas madali ang pag-dry. Mas mabilis ang pag-dry na yung oral mucous membranes. Oxygen therapy, mga naka-oxygen, decreased salivation, temperature extreme, and yung mga patients na nothing, na NPO, na bawal pa kumain. Nung wala yan silang, mahirap, prone yan sila at risk for oral problems. Mechanical factor like surgery, broken teeth, or ill-fitting dentures, autoimmune disease, or infection. Pwede yan sila maging related to or yan etiology for altered oral mucous membrane sa ating NCP. Okay? Then for the planning, so ADPI, assessment, then you're going to plan. Planning na tayo. These are the detailed nursing activities performed by the nurse that may include the following. Okay? Kindly read. Sino ba pwede makabasa? May I call on Miss Taktakon. Kindly read the following nursing activities for our planning.
Some detailed nursing activities performed by the nurse may include the following. Monitor every shift for dryness of the oral mucosa. Monitor for signs and symptoms of glossitis or inflammation of the tongue and stomatitis or inflammation of the mouth. Third, assist dependent clients with oral care. Fourth, provide special oral hygiene for clients who are debilitated, are unconscious, or have lesions of the mucous membranes or other oral tissues. Number 5, teach clients about good oral hygiene practices and other measures to prevent tooth decay. Number 6, last, reinforce the oral hygiene regimen as part of the discharge teaching.
Okay, thank you, Ms. Taktakon. Okay, so yan ang ating planning. Okay, the planning method, goals of care. Okay, in planning care, the nurse, if appropriate, the client and family set outcomes for each nursing diagnosis. Okay? The nurse then performs nursing interventions, dyan na yung implementation natin, and activities to achieve the client outcomes. During the planning phase, the nurse also identifies interventions that will help the client achieve these goals. So, kailangan piliin mo pa rin yung appropriate intervention for that specific patient. Hindi lahat ng nasa nanda na nandoon na plan of care or interventions is same para sa lahat, no? True to all. So, kailangan careful pa din kayo sa pagpili ng interventions depending on the condition of the patient. Now, specific detailed nursing activities performed by the nurse may include the following, sinabi ni Ms. Taktakon. Okay? So, that's the planning. Then, let's proceed sa implementation, sa implementing phase. So, good oral hygiene includes, but first, providing oral hygiene is an independent nursing function. So, di ba sa NCP natin, nilagay tayo ng independent, dependent, and collaborative. But this is an independent nursing function. Pero daw, yet, research has shown that oral hygiene is one of the most overlooked aspects of basic nursing care. Okay? Moreover, the oral care provided by nurses is often inadequate. So, parang nagsalig lang, parang pinapabayaan lang, no? Yung oral hygiene. Okay? So, importante pa rin ang oral hygiene. So, barriers to providing effective oral care include the low priority placed on oral care by primary care providers and nurses, many of whom treat it as comfort measure lang, no? Rather than a reduction of bacteria that can cause disease. Inadequate knowledge of how to assess and provide effective oral care, lack of appropriate supplies, like wala tayong suction toothbrush for dependent clients. Meron kasing ganun na klase na toothbrush, no? And insufficient time. So, yun yung mga causes, no? Kaya hindi masyado pinapractice ng oral hygiene care. Hindi masyado binibigay sa pasyente. Minsan lang. Okay? Studies have shown that when oral care is part of a written protocol, nurses document oral care consistently. Kapag sa isang hospital or agency, pag meron na silang protocol doon na kailangan talaga every shift or sa iyong duty is kailangan meron talaga kayong i-provide na oral care sa patient. No? Kung written protocol na siya, so tendency niyan, gagawin talaga ng nurses. No? Meron sa checklist niya na doon na kailangan na provide ba ng oral care. So successful siya, no, ang implementation mo. Or sa iba, wala nang ganun. So it depends on the agency or the hospital you're working with. So, good oral hygiene includes daily stimulation of the gums. So, ma-stimulate yung gums, no, ng patient natin pag mag-brush ng teeth. So, there's blood circulation. Then, mechanical brushing and flossing of the teeth and rinsing of the mouth. Okay? Yan siya. So, nagkamit siya ng, as you can see sa picture, may mouthwash and nag-brush ng teeth yung client. So, brushing and rinsing stimulates salivary flow and removes harmful bacteria. Alam natin yan. Now, the nurse is often in a position to help clients maintain oral hygiene by helping or teaching them to clean the teeth and oral cavity. And then by inspecting whether the patient or the client, especially children, have done so, or by actually providing mouth care to clients who are ill or incapacitated, hindi na kaya na mag-provide ng oral care sa sarili. Okay? So, mag-assist tayo, mag-help tayo sa patients na i-maintain natin yung kanilang oral hygiene. Also, the nurse can be helpful in identifying problems that require the intervention of a dentist or oral surgeon and arranging a referral. So, we have that power, no, na pwede tayo mag-refer sa oral surgeon or dentist just by assessing the patient. No, doon kanina sa assessment natin, di ba? Marami na tayong nalaman yung chelosis, gingivitis. Okay. Pag makita natin na gano'n yung assessment natin sa patient, so we will include that in our nurses notes, in our assessment, in our flow sheet. So the doctor can also see that. Or pwede mo i-confer with the doctor, di ba? That's called a referral din. Okay? Now, let's proceed to the promoting oral health throughout the lifespan. So, sa lifespan, meaning from birth to to elderly. Okay? A major role of the nurse in promoting oral health is to teach clients about specific oral hygiene measures. So let's answer true or false. Okay? So sa infancy tayo, to newborn to infancy, most dentists recommend that dental hygiene should begin when the first tooth erupts and be practiced after each feeding. Okay, may I call on? Sino maka-answer? Miss Molihon, true or false? Is Miss Molihon around? Wala? Miss Natad,
Uh, False, ma'am.
bakit false?
Uh, for me, ma'am, mas kanang ay hygiene man, ma'am. Sa
Should
ako, ma'am,
begin. Should begin
murag
when the first tooth erupts.
recommend. Sa ako kasi, ma'am, koan ka ng um, isa tawagan ni ka ng dili siya siguro pa kaayo sa recommended kay kanang mas isip mas ano mo gud sa mamurag kanang dali maano ilahang gums po dali tawag ani kanang dali lagi siya masamad mo if ever mag ano man siya.
Okay, sige. False kay Miss Natad. Thank you, Miss Natad. So, when you read the statement, most dentists recommend that dental hygiene should begin. So, it will start the oral care. You start the oral care when the first tooth erupts. Kapag nagkaipin na yung pasyente, yung bata. No? And be practiced after each feeding. So, mag-oral care ka ba sa baby, ang infant newborn, nag-breastfeeding lang? 'Di ba? Wala na, no, not needed na unless merong thrush, no, or may infection. So the answer here is true. Okay? When the first tooth erupts, syempre meron ng ngipin. So anong gawin mo? Kailangan nalinisan mo na yung ngipin ng pasyente. Okay? Nakuha nyo? Am I clear? Okay, later on. Later on. Okay, later on. Sige. Ayan. Cleaning can be accomplished by using a wet washcloth or small gauze moistened with water. True or false?
True, ma'am. True po.
Okay, true. Okay. True, very good. Yan ha, for the infants. Okay? Yan ang gagawin natin. Wet washcloth or small gauze moistened with water. Next, kindly read and answer. Sino pa pwede tayong tawagin? Sinong present? Miss Swelto.
Dental caries occur frequently during the blank period, often as a result of the excessive intake of sweets or a prolonged use of the bottle during naps and bedtime. Ano ang answer, ma'am? Toddler, ma'am.
Okay, very good. Toddler. Okay, bakit kaya toddler? Kailangan naman infancy. Excessive intake of sweets, nagkakain ba ng sweets ng infancy? School age, no? Nag-bottle pa rin, use of bottle during nap. So, nag-bottle feeding ba ang school age and preschool? So, toddler is the correct answer. Very good. Okay, next. So, the nurse should give parents the following instructions to promote and maintain dental health. Okay? These are for the infants and toddlers. So kindly read, Miss Seda. Is Miss Seda around? Sige, wala si Miss Seda. May I call on Miss Rubas.
Begi- Beginning at about 18 months of age, brush the child's teeth with a soft toothbrush. Use only a toothbrush moistened with water at first and introduce toothpaste later. Use one that contains fluoride. Give a fluoride supplement daily or as recommended by the primary care provider or dentist unless the drinking water is fluoridated. Schedule an initial dental visit for the child at about 2 or 3 years of age as soon as all 20 primary teeth have erupted. Some dentists recommended an inspection type of visit when the child is about 18 months old to provide an early pleasant introduction to the dental examination. Seek professional dental attention for any problems such as discoloring of the teeth, chipping, or signs of infection such as redness and swelling.
Okay, thank you for reading. So these are the instructions to promote and maintain dental health. Okay? So preschoolers and school-age children na tayo because deciduous teeth guide the entrance of permanent teeth. Ano ibig sabihin ng deciduous teeth? Do you have any idea? Ano ibig sabihin ng deciduous?
Baby teeth.
Baby teeth, milk teeth, yes. No, yung pinakaunang ngipin. No, yung natatanggal sa atin. Okay? Dental care is important to keep these teeth in good repair. Abnormally placed or lost deciduous teeth can cause misalignment daw of permanent teeth. True or false? What's the answer? Anyone? Abnormally placed or lost deciduous teeth can cause misalignment. Can. No? Can daw. Can cause misalignment of permanent teeth.
True, ma'am.
Okay, possible. No, basahin niyo mabuti ha, lalo na sa board exam mo, board exam na kayo in the future. No, ang pag ano, ang sentence construction, intindihin din ninyo. Kaya sinasabi ko can. So there's a possibility can cause misalignment of permanent teeth. Oo naman, no? So that is true. Okay? Ang other terms sa deciduous teeth ha, baby teeth, milk teeth, or primary teeth. Teeth. Okay? Sige. Now, continue promoting oral throughout the lifespan sa ating preschool and school-age children. Kindly read and answer. Anyone? Any volunteer? Texon? Nandiyan na ba si Miss Texon?
Fluoride, ma'am.
Okay, can you read and answer?
Promoting oral care at blank remains important at this age to prevent dental caries. B, ma'am, fluoride.
Okay, very good. Fluoride. Okay? Fluoride is the one protecting your teeth. Okay, kaya mga toothpaste, kailangan may fluoride siya. Okay, next. Any volunteer? Read and answer, please. Tanhili, nandyan na ba? Yes, sino nag-raise ng hand? You can read and answer, please. Cannot see your ano kasi. Pinaka-share screen ako. Miss Tanhili. Nandyan ba si Miss Tanhili? Tindoy. Wala ito sila kanina. Calling the attention of Mark Tindoy. Wala? Wala pa din?
Ako na lang, ma'am.
Ano? Okay, Abeledo.
Gonzaga po.
Okay.
Preschoolers need to be
Sige.
taught to brush their teeth after eating and to limit their intake of refined sugars po. Letter A.
Okay, very good. Letter A, refined sugars. So food contains refined sugars Ano yun sila? Example niyan, mga cane sugar, brown sugar, corn sweetener or syrup, mga fruit juice concentrate, malt sugar, or anything ending in OSE, mga fructose, dextrose, mga
Ma'am
preschooler
Ro.
to brush their teeth.
Nipilit
Next,
ka, ma'am. Nipilit jud ka, ma'am.
Hang, ma'am.
apelyido,
Ma'am, nipilit. Wala may ka dog sa mong discuss ganyan na, ma'am. Nipilit ka.
unsa ni pilit?
Loading
Ay,
ka,
Ni
napilit
ma'am.
ko. Asa ko napilit
niloading ka,
dire?
wait na nawala mo tingog. Sa
Asa
previous
na
slide.
part?
Yeah,
Sorry for
previous
the
slide, ma'am.
internet connection. Ito,
Yes,
this
ma'am.
one,
Pag-discuss mo
sa
na, napilit
fluoride.
ka.
Okay.
Dili na isa, ma'am.
Fluoride. Importante ang fluoride kaya merong fluoride sa ating mga toothpaste. Okay? To prevent dental caries. This, ito,
Sa
Sa
refined sugar,
refined
ma'am.
sugar, ma'am.
okay, refined sugar. Okay, the answer here is refined sugars. Okay? Anong examples ng refined sugars natin? Do you have any
Candies,
idea? Candies? Yes? Ano pa? So, yun yung mga cane sugar, brown sugar, mga corn sweetener or syrup, fruit juice concentrate, malt sugar, or anything ending in OSE. Yung mga fructose, sucrose, dextrose, yan yung refined sugars natin. Okay, so naintindihan? Am I
Yes,
clear?
ma'am.
Okay, sige. Magtanong ako ha kung ano baka mawala na naman ako. I'm sorry. Morning. Ayan. Sino mag-ano ito? Volunteer. Last points ito ha for your oral participation.
Ma'am, wala na next ang slide po. Wala na
Ano?
move
Nawala
po.
na naman ako.
nipilit,
Wala
ma'am.
na
Meron,
move.
ma'am, pero yung slide,
Ang
wala na
slide mo,
ano
ma'am, nalihok.
next.
Okay, ito meron na yung lalaki, bata.
Wala pa po.
Wala po, ma'am.
Matag, grab. Lulipap.
Wait lang ha.
Opo.
I'm having internet problem connections
Meron
for
na
a
po.
while,
Nga na,
class.
ma'am.
Sige, break muna tayo. Be back at 10 a.m. Sige, break na muna. Be back at 10 a.m. ha. It's
Yes, ma'am.
9:52, bladder break or ano ba, magkain na muna sandali. Be back at 10 a.m. Okay? We'll
Yes, ma'am.
continue
Opo,
later.
ma'am.
Thank you. Okay, it's already 10 a.m. Let's continue the discussion. So can you see it? Can you see my screen?
Yes, ma'am.
Okay.
Yes po.
So, sino ang basa and answer, read and answer, volunteer?
Ako na lang, Ma'am Himpit.
Okay, Miss Himpit.
Yes, ma'am. Parental supervision may be needed to ensure the completion of these self-care activities. Regular dental checkups are required during these years when blank teeth appear. Permanent po, Ma'am C.
Okay, letter C, permanent teeth. Okay? Regular na ha ang dental check-ups kapag nagkaroon na ng permanent teeth ang pasyente, ang bata, school age. And so this is the correct amount of toothpaste for children. So alam nyo ba ito? Ano yung correct and incorrect na paglagay? No? Ilan ang ilagay? Ay gano'ng kadami ang ilagay? It is common for children to use more toothpaste on the toothbrush than what is needed or what is in the child's best interests. Too much toothpaste increases the chances of your child consuming too much fluoride. Okay? This is incorrect for the child's kung gaano kadami ang toothpaste na gamitin niya to brush the teeth. The above illustration shows the incorrect amount of toothpaste for a child. This amount could be swallowed by the child, increasing or exceeding the daily amount necessary. So, may patient kami before na school age, kaya masarap lagi daw ang toothpaste, kinain niya yung toothpaste. So, later on, nagsuka-suka yung bata. Okay, ang iba wala silang knowledge about it, no? Akala nila okay lang nakainin ng toothpaste. Okay, so ganito lang kalitang ilagay sa toothbrush ha, for the children, pea size lang, and or the size of their fingernail. Okay, so nakuha nyo?
Yes po, ma'am.
Okay, very good. No, sa adolescents na tayo and adults, you can read and answer.
Ako na lang, ma'am.
Yes, apelyido.
Lasherda po.
Blasherda, okay, go.
Blank have become increasingly popular among adolescents and adults. School nurses may be the first and perhaps the only source of information about body piercings for children and adolescents. D, ma'am, oral piercings.
Yes, letter D, oral piercing. So, popular siya, no? Common siya sa mga adolescents and adults. So, hindi maiwasan na, kunyari, nagtrabaho tayo sa school, no? Meron tayong mga students doon na gumagamit ng ganito. Siyempre, paano natin sila i-approach, no? Dito na mga stage pag adolescent, no? Adolescents, dyan yung gusto nila na may freedom sila to do what they want, di ba? So, pwede mo lang sila i-instruct na this can cause infection, ganyan, or nuisance sa kanila, pero will depend on their decision pa rin. At least hindi tayo nagkulang no, na mag-intervene or magbigay ng mga health teachings regarding na piercing sa katawan. Okay, so as you can see sa picture, may iba't ibang klase ng piercings dito. So ayan, nakita niyo pa this under the tongue. Dito lang saan ba ito? Under the upper lip. Ayan. So eventually, this may cause swelling nung iba magkaroon ng swelling and infection. Okay, hindi lahat. No, this is not appropriate for me, no, pero depende lang yan sa magdala niyan. Pero actually, it's not good. Okay, oral piercings. It can cause infection kasi. Okay, client teaching for adults and adolescents, measures to prevent tooth decay. Kindly read. Sino pwede makabasa? Yes? Volunteer, apelyido?
Ontal, ma'am.
Okay, go. Ontal.
Measures to prevent tooth decay. Brush the teeth early after meals and at bedtime, as these children are inspect their mouth to be sure that teeth are clean. If the teeth cannot be brushed after meals, vigorous rinsing of the mouth with water is recommended. Floss the teeth daily. Ensure an adequate intake of nutrients, particularly calcium, phosphorus, vitamin A, C, and B, and fluoride. Avoid sweet foods and drinks between meals. Take them in moderation at meals. Eat coarse, fibrous foods um, or cleansing foods such as fresh fruit and raw vegetables. Have topical fluoride applications as prescribed by the dentist. Have it checked up by a dentist every 6 months.
Okay, thank you, Mr. Ontal. So, yun ha, check up by a dentist every 6 months, twice a year. Pero it's not limited to twice a year. So, kung may problems kayo sa oral health ninyo, you can visit the dentist, no? And as you can see, kapag walang toothpaste, no, napunta kayo sa isang lugar, tapos stranded kayo doon, and you have only water, tapos wala kayong toothpaste, so kailangan mag-rinse pa rin kayo ng mouth ninyo with water. Eh, kasi yung bacteria doon na nagstay, so wag mo na palalain yung bacteria. We can always gargle with water, plain water. Or if merong salt, no, better. Okay? Then why do we need to floss the teeth daily? Anyone? Ba't kailangan mag-floss? Nag-floss ba kayo ng inyong ngipin araw-araw?
Yes,
Yes,
ma'am.
Yes.
ma'am.
Okay, so paano pag may braces, ma'am?
Floss
Floss
din.
din hapon, pero ipadaan mo na sa taas, no? So,
Yes.
masyadong matagal matapos ang proseso pag may braces. Okay? So, you need to floss the teeth daily kasi mag-build up yung plaque dyan or later on, baka maging tartar. No, mahirap pag maging tartar na kasi yung ngipin mo, hindi na siya yung even. No, nagbaon na doon yun, tapos maging tooth decay eventually. Okay? Then, kailangan daw natin ng vitamins A, C, and D, fluoride, calcium, phosphorus. Okay? To adequate intake of nutrients for better oral health. And avoid sweets. Hindi naman talaga natin maiwasan na magkain ng mga sweet foods, lalo na pag may sweet tooth tayo. Avoid daw sweet foods and drinks between meals. Okay, so pwede lang siyang kainin. Mas okay siya kainin. I-take them in moderation at meals. Isabay mo siya sa meal mo. No, kasi kung magkain ka ng between meals ng sweet foods and drinks, no, increase acidity and bacteria loves sweets din also, no? Sa mga sweets. Gusto yan nila ng sweets. So, yung magdami yan sila, madali lang yan sila magdami sa yung mouth, sa yung teeth, ang mga bacteria. Okay, cleansing foods. Ano example ng mga cleansing foods daw? Fibrous foods. Example.
Watermelon, ma'am.
Yes, yes. Okay, yung mga fresh fruits and raw vegetables. Okay, topical fluoride application, meron binibigay ang dentist niyan, lalo pag weak yung teeth ng pasyente, pag may periodontal disease, yan, meron yan silang mga fluoride applications na nire-reseta ng dentista. Okay? So, minsan, hindi tayo makapunta ng dentist, no, every 6 months talaga, depende lang, no? So, kahit na feeling mo na normal lang, kailangan mo magpa-cleaning pa rin. Kasi merong plaque yan eh. No? Sabi ko, plaque, it can lead to tartar. Okay, thank you, Mr. Ontal. Next, saan na tayo? Tapos na tayo sa adults and adolescents, preschool, school age, infancy, newborn. Ngayon sa older adults na tayo sa lifespan consideration natin. So, nakalagay dito, the rate of edentulism. Okay, new word, no? Edentulism, meaning lack of teeth among older adults continues to decline. Napansin ninyo yung mga lolo-lola ninyo, di ba? Natatanggal na ang ngipin. That is called edentulism, rate of edentulism. Now, that is normal, of course. Wear and tear theory. Okay? So, as a result, older clients are at risk for dental cavities and periodontal disease. Okay, weak na ang gums din ng older clients natin. So, who can read and answer this one?
Ako, ma'am.
Apelyedo?
Abaw po.
Okay, Miss Abaw.
Older adults who have self-care deficiencies are at an increased risk of poor oral health because A, they They still love eating sweets, be they can't maintain their oral hygiene practices or may not be able to visit the dentist in a routine basis. C, they cannot communicate well with others. And D, they often forgot to brush their teeth. B, ma'am.
Letter B. Okay, very good. Letter B. Sige. Furthermore, thank you. Lista ko ha. Sige. Furthermore, those who suffer the worst oral health and hygiene include older adults talaga, no? Lalo na yung nag-reside sa nursing homes. And yung mga pasyente na merong dementia. Okay, may mga dementia. What is dementia? Anyone? What do you mean by dementia?
Makakalimutin, ma'am, ka nung
Kalimtanan, ma'am.
Yes, yes, pwede na yan. So, dementia, nagabalik sa pagkabata. No, na nakakalimutan na. Yan, signs yan siya, symptoms. Hindi na nila alam kung nakakain na sila. Sabi nila, ini-insist nila sa nurse na, tapos na ako kumain. Or hindi pa ako kumain. Or actually, kumain na siya kanina. No? So, sakit yan siya ng dementia. Okay? Poor oral hygiene among frail and dependent nursing home residents can place them at risk for serious illness such as ano kayang klaseng sakit? Pagkulang ng oral hygiene care, 'di ba? May bacteria, napundo na ang bacteria sa mouth, then pupunta dito sa throat, pupunta sa lungs. Anong sakit yun siya na mapunta sa lungs, doon yung bacteria. Mag-ubo na ang pasyente, may plema na. Anong sakit yun? Letter P ang nag-start. Yes, pneumonia. Okay, pwede sila magkaroon ng pneumonia. Okay, they still love eating sweets. Hindi naman, no. Others, no. Okay, hindi naman kumakain talaga ng sweets. Not true to all. They cannot communicate well with others. Not all. They often forget to brush their teeth. Not the best answer. So they can't maintain their oral hygiene practices or may not be able to visit the dentist in a routine basis. Okay? So, examples of interventions that can improve the oral health of residents in long-term care settings include, so ano ibig sabihin ng long-term care settings? Kung mag-duty na kayo in the future, maka-duty talaga kayo, no? Sana nga sa mga home for the aged. No, yan siya, mga long-term care settings. Yan siya. Consistent oral assessment by the nurse. That's why kanina sa assessment natin, di ba, pinag-aralan natin kung paano mag-assess ng gums, ng teeth, ano iba't ibang klaseng sakit, ganyan. So, at least alam na natin, no, meron tayong knowledge about that kasi magagamit natin yan in time na may interaction na tayo with the patient. So, consistent, tuloy-tuloy yung ating oral assessment sa kanila. By that, malaman natin kung may abnormality ba, no? O may problema. Instruction of AP, the attending physician, on how to deliver effective oral care. Okay? So, this included yan siya, no? That can improve the oral health of the residents. Then you provide sufficient oral hygiene supplies and expectations of the administration that oral care should receive the same priority as other kinds of care. Yun na yung sabi ko kanina before na kung sa isang hospital or agency, ginagawa na nilang routine or kailangan may written order talaga na kailangan mag-provide ng oral care or oral hygiene yung nurse sa patient o maging successful or magkaroon ng better oral health ng patient talaga. Okay? So, along with the increasing evidence that poor oral health is a serious problem among older clients is the lack of effective oral care by health caregivers. Usually, ang ating, di natin maiwasan no, sometimes ang ating focus is dun sa physiologic, kung ano yung sakit mismo ng pasyente. And sometimes, yun nga, comfort lang ang tingin natin sa oral hygiene. Pero this can lead na talaga na pwede siya magkaroon ng pneumonia. Okay? So nurses have an important role in promoting optimal geriatric oral health care.
Ma'am, excuse me po, wala nag-move ang slides.
Wala pa, hindi pa. Nagsalita pa ako na. Okay? Sige. Next slide na tayo. Okay, can you see it? Brushing and flossing the teeth. Okay, kindly read. Sino mag-volunteer? Yes? Apelyido?
Natad, ma'am.
Okay, natad.
Brushing and flossing the teeth. Thorough brushing of the teeth is important in preventing tooth decay. The mechanical action of brushing removes food particles that can harbor and incubate bacteria. It also stimulates circulation in the gums, thus maintaining their healthy firmness. One of the techniques recommended for brushing teeth is called sulcular technique, which removes plaque and cleans under the gingival margins.
Okay. Is it familiar to you? Thank you, Miss Natad. Is it familiar to you? Ano meaning ng sulcular technique? Alam nyo ba yan, class? When brushing your teeth?
Up and down, ma'am?
Are you sure? Do you have any idea? Sulcular technique? Up and down? What
In front
else?
in front of your while brushing your teeth, ma'am, in front of your teeth, ma'am, do a circular motion while brushing your teeth.
Okay. Sino yung nagsalita? Si Mr. Maulana ba yun?
Antegro, ma'am.
Ah, si
Pinagawa ko po siya.
Antigro. Ah, si Mr. Antigro. Andyan ba si Mr. Maulana? Wala siya kanina, no? Okay. So, tingnan natin ha, ano meaning ng sulcular technique. Or before that, thorough brushing daw of teeth is important in preventing tooth decay. No, para hindi tayo magkaroon ng tooth decay, mag-brush talaga ng teeth. Para, that's the way to remove the bacteria or the food debris in your teeth. Okay? Mechanical action. So, mechanical action, ikaw mismo ang mag-brush. No? You do it mechanically. Or merong pabenta na toothbrush yun sa Watson na yung maikot-ikot lang siya. Yan. Meron yung gano'n na klaseng toothbrush. Usually, binibili yung mga para sa mga elderly. No? Kasi mahirapan naman yan sila mag-control no, while brushing their teeth. So, meron tayong electronic toothbrush. Okay? Then, stimulate niya ang circulation sa gums kasi syempre pag brush natin, matouch man yung gums, no? Pag ma-stimulate yan, may mga receptors yan siya, mag-send ng mga signals to increase the blood supply papunta doon sa inyong ngipin, sa gums. Okay? Maintaining their healthy firmness. Kailangan firm, hindi laylay, hindi spongy ang gums, no? Hindi nag-bleed. Okay? So, ang technique daw, no, is called the sulcular technique, which removes plaque and cleans under the gingival margins. Not just the teeth, but also you have to clean inside, no, the gingiva, no, sa inside sa gums. Kasi yun doon una nagsa-start nagpo-form yung plaque eh. And yung tartar. Napansin nyo, itignan niyo yung teeth nyo ba? Doon siya nag-lodge yung mga food debris sa may gingiva or sa may gums. Okay? So we will watch a short video about sulcular technique para aware tayo ano yung sulcular technique na yan. So, ano lang to siya? Seconds lang. Dali, ha? So, para may idea tayo ano to siya. Again, alam natin ano yung correct way. Can you see my screen?
Yes po, ma'am.
Yes, ma'am.
Okay, I'll play it na.
The modified sulcular technique of toothbrushing starts out with the toothbrush at 45 degrees to the teeth. We then push the bristles into the sulcus and vibrate the brush back and forth, and finish with a sweeping motion away from the teeth. Note here that the bristles are in the pocket as well as on the gum tissue. This technique is more involved but is a very effective brushing technique, yielding excellent results.
Okay. So, naintindihan? Yun ang sulcular technique. Nakuha nyo?
Yes.
Note here
Yes,
that the
ma'am.
bristles are in the pocket.
Okay. So, napapasok yung bristles doon, no? Pwede pala mapasok inside the gums. No? And you do the vibration technique and then you sweep it out. Okay, that's the sulcular technique. In that way, the food debris or the bacteria or the other, ano pang maiwan dyan ng mga mag-lodge sa teeth, matanggal. But still, we need to floss our teeth pa rin. Okay? Yes?
Ma'am, will that cause
Yes,
bleeding,
Mr.
ma'am?
Fibon?
Will that cause bleeding? Sa bis experience naman ba, nag-try ko ginana ni dugo ako gums.
May dugo. Okay, masyadong grabe, masyadong ano, yung bristles mo is matigas. Use soft bristle toothbrush. Okay? Huwag gumamit ng matigas na bristle na toothbrush. Okay? And gentle lang. Di ba? Sabi nga, dapat gentle lang ang pag-brush ng teeth. Ilang minutes ba dapat mag-brush ng teeth? Meron ba nakatalaga talaga na ilang minutes? Dapat ditong ilang minutes kayo. Meron ba?
5 to 7 minutes yata.
5 to 7 minutes talaga.
Ma'am,
Ano mangyari sa inyo?
It depends siguro,
Meron
ma'am.
ba? Okay, it depends kung ano ba kinain mo. Kumain ka ng pusit, ulam yung pusit. Okay, ano yung mga tao na merong braces. Mas matagal yung may braces. Ang hirap pag may braces, no? So, meron tayong maliliit na mga brush para sa may braces. Yun. Kasi ang toothbrush, hindi siya makaya. And meron din toothbrush for those people na may braces. No? Mabili din siya. Meron din ganun. Okay, may manufacturer din. Okay, anyway, let's continue. So, visible na ba in your end? On your end? Okay na?
yes po, ma'am.
Ayan.
Yes po.
Ma'am.
Yes po,
So,
ma'am.
let's continue. What is the recommended toothpaste? Okay, so alam naman natin, no? Many toothpaste are marketed. So, market yan. Ang better daw ang Colgate is close-up kasi meron ganito, ganyan. Yan. Pero the best one is the fluoride toothpaste. So, tingnan ninyo kung meron siyang content na fluoride. It is often recommended because of its antibacterial protection. Okay? Ano ang benefits niya? It can remineralizes tooth enamel. So, bagong minerals, no? And exerts antibacterial properties, prevents further decay. Okay? Now, we're going to proceed with how to care for artificial dentures. Anong Tagalog ng dentures?
Postiso.
Postiso. Sino nakakita na kayo ng postiso, no? Are you
Yes,
familiar with
Oo,
postiso?
ma'am.
Yes, okay. So, some clients have artificial teeth in the form of a plate. Ang tawag niyan, plate. A complete set of teeth for one jaw. Okay? They may have a lower plate or an upper plate. So, kung makita kayo na ganito, upper plate ang tawag niyan. And sa kanila, may upper plate and may lower plate. Well, okay, so when only a few artificial teeth are needed, so hindi naman lahat, no, kaya may iba na wala talagang ngipin lahat, no, yung mga elderly natin, or kahit hindi elderly, may iba na nawala na talaga ng ngipin. When only artificial teeth are needed, the client may have a bridge. So, ang tawag ito bridge. Yan. Okay? Rather than a plate. Ito kay plate. Bridge. Bridge lang ang kanilang kailangan. So, this bridge may be fixed or removable. Pwede matanggal-tanggal. Or pwede nandiyan na siya forever. It depends lang. Pero, mas better if yung matanggal-tanggal para ma-disinfect mo, malinisan mo din. Okay? So, artificial teeth are fitted to the individual and usually will not fit another individual. So, bawal maghiram-hiram ng dentures, ha? Baka naghahiraman ng dentures para lang makakain yung mga lolo at lola natin. True or false?
True, ma'am.
Okay? Okay. True. Okay? Will not fit another individual. Sige ha, hindi na maghiram-hiram ng dentures, ha? Okay. True yan siya. So, kindly read this one. Sino mag-volunteer yung wala pa naka-oral
Ako po, ma'am.
participation? Apelyido?
Aretiza, ma'am.
Okay, go Retiza. Mr. Retiza.
Caring for artificial dentures. Clients who wear dentures or other types of oral prostheses should be encouraged to use them. Second, ill-fitting dentures or other oral prostheses can cause discomfort and chewing difficulties and can contribute to oral problems as well as poor nutrition and enjoyment of food. Third is those who do not wear their Prostheses are prone to shrinkage of gums, which result in further tooth loss.
Okay. Thank you, Mr. Retiza. Okay, so ang dentures is a type of oral prosthesis. Okay, meron tayong mga iba't ibang klaseng prosthesis, no? Meron sa kamay, kunyari na-amputate yung paa niya. Meron tayong leg or knee prosthesis, ganyan. Okay, ito naman, oral prosthesis ang tawag nito. So, we must encourage our patient na gamitin ito siya, lalo na pag kumakain. Pero, kahit hindi na kumakain, kailangan gamitin pa rin nila ito, no? Kasi there's a possibility daw na mga disease. Anong mangyari sa pasyente pag hindi sinusuot ang kanyang dentures? Anong mangyari?
Shrink.
If the client, yes, mag-shrink ang gums. No, may pasyente kami ganyan, nag-shrink ang kanyang gums. No, so hindi niya kasi sinusuot ang kanyang denture. So balik na naman siya sa dentist naman. Paulit na naman magpasukat. No, so gasto lang. 'Di ba? Okay, and yung iba, yun yung pag wala na talagang ngipin, wala na talaga silang ipin talaga up and down. Pero yung iba naman, meron pang naiwan, tapos maya-maya hindi naman sinusuot yung dentures or yung bridge. Ang nangyari, nag-shrink pa rin yung gums, so hindi naman mag-fit no, sa mga katabi niya na ngipin. So, balik na naman tayo sa dentist, di ba? So, ill-fitting, hindi fit sa kanya, no? Kaya kunyari, nag-shrink na yung kanyang gums, it can cause discomfort. So, pwede niya yung iba, may mga pasyente kami na pagkagabi, no, sa emergency room, may mga patient kami na magpunta sa ER kasi natulog sila, no, tapos nakalimutan nila tanggalin yung kanilang dentures, no, yung bridge, tapos nag-snore yung patient, tapos nahulog yung denture na tulon niya. Okay? Naswallow niya yung dentures. Kasi matakot lagi daw siya natanggalin yung kanyang dentures kay lagi daw ang gums, mag-shrink. Pero ang lang nun is, yun nga, pagtulog niya, naluag ang denture, na swallow niya, so natakot siya. So ang ginawa ni Doc, pina-x-ray namin kaya baka napunta sa lungs. Pero we monitor the patient, wala namang difficulty of breathing, ganyan. So monitor na namin siya sa emergency room, pina-x-ray, stat x-ray. So, meron man yan siyang metal, no? So, nakita na nandoon siya. Wala siya sa lungs, no? Wala siya sa lungs. Siguro nasa stomach siya. Hindi man kasi makakita talaga sa stomach. So, hintayin na lang yan na mapatain niya, no? Malabas niya yun, matain niya yung kanyang dentures. Isa lang din kasi yun ang ngipin. Okay? So, yun yung isang totoong incident na nangyari sa ER. Buti na lang hindi siya napunta sa lungs. Okay? Mahirap pag sa lungs napasok. Okay, kindly read.
Artagami
Ano
po,
pa
ma'am.
dyan? Okay, Artagame, please.
Caring for artificial dentures need to be cleaned regularly at least one a day. They can be removed from the mouth, scrubbed with a toothbrush, rinsed and reinserted. Third, some people use a dentifrice toothpaste for cleaning teeth and others use commercial cleaning compounds for dentures.
Okay, thank you, Mr. Artagame. So, like natural teeth, artificial dentures collect microorganisms and food. Okay, so hindi lang siya, akala din malinis lang siya, no, ganyan, pero yun, kailangan pa din siya i-brush, no, using this specific kind of toothpaste na usually prescribed by the dentist, yung dentifrice. Okay, yan siya for cleaning teeth, na dentures. Next, caring for the artificial dentures part. Ito sa ating nursing care din, ha. Okay, you remove the dentures of the patient, you clean them manually, and then also clean the gums of your patient. May mag-lodge pa rin dyan ng mga food debris or microorganisms, no? And then rinse the mouth by using mouthwash, and you can soak your dentures. Okay? By soaking the dentures overnight, you will not only be able to thoroughly clean them, but you will also be able to store them. When you soak your dentures in denture cleaners, so pwede meron tayong tinatawag ng mga denture cleaners, bacteria will be killed. Okay, so kaya makita yung mga lolo-lola ninyo, meron baso doon na merong tubig. No, pwede siya hindi tubig, pwede gumamit sila ng mga denture cleaner solution yan siya. No? So, pwede din siya i-prescribe by the dentist or pwede lang mabili sa pharmacy, OTC. No questions? May nag-raise ba
Ma'am,
na?
number lang po ba ang kanang sa dentures nila, ma'am, na yellowish po, ma'am?
Yellowish meaning matagal na yan and baka nung kaya nag-yellow na ang dentures niya kasi baka nagainom ng coffee ang patient na yan or tea-colored na cola, mga ganyan. Mag-yellow
Okay
na.
po, ma'am. Thank you po.
Now, if you're not wearing your dentures, you should soak them in water or a denture cleanser to prevent warping. Ano ibig sabihin ng warping, class? Okay, mag-shrink siya, warp. You should remove and clean your dentures before bed. No, it is advisable, no? Kasi pwede mangyari yung sinabi ko na situation kanina, no? Lalo na pag isa lang, bridge lang ang meron, may possibility na ganun. And matanggal din siya, no? Pero may iba yung, kaya may tinatawag na polydent, yun, para magdikit siya, lalo na when you're eating hard foods. Yan. So, be sure to place them in a denture soaking solution or water. Pwede lang din water, class. Dentures that dry out can crack or warp. Kung hindi nyo i-soak, kung hindi nyo gamitin, no? Pwede nyo ito health teaching sa patient na may dentures. Itong ating discussion ngayon. Kapag hindi nyo siya i-soak, ma'am, sir, pwede po mag-crack, no? Or mag-warp or mag-shrink yung inyong dentures. No? So, be sure to na always sila moist. Okay? And you should never put your dentures in hot water because this would cause them to warp, magliit, no, mag-shrink, and mag-crack pag hot water. Okay? So at least meron na tayong alam no paano tayo magbigay ng health teaching sa mga older clients natin. Okay? Now we're going to watch a video on caring for artificial dentures.
Hey everyone, it's Sarah, registered nurse. It's
registered nurse or a very informative nurse. Okay, so let's watch her video on how to do denture nursing care or denture care nursing, how to clean the dentures. So is it visible? Sa yung screen? Narinig nyo ba ang audio ng ating YouTube? Kanina? Okay, sige. Sige, mag-mute muna ako.
with registerednursern.com, and in this video I'm going to go over how to clean dentures as a nurse. So as a nurse, you're going to be providing care to patients who wear dentures, and your role will include helping the patient take those dentures out, cleaning the dentures, and providing mouth care, because a lot of times patients are really sick and they can't get out of bed and do this like they normally would at home. So you'll help them at night with doing that because they don't sleep with the dentures at night, and you'll help them in between the meals after they eat. And some things you want to keep in mind whenever you are taking care of dentures is that you don't damage them because they're very expensive, and they don't become lost because you have a lot of people going in and patients
Naputol po, ma'am. Yung audio.
po, ma'am.
Denture cup, which you'll want to put a patient label on the denture cup, on the lid, or write the patient's name, the room number. So you'll help them at night with doing that because they don't sleep with the dentures at night, and you'll help them in between the meals after they eat. And some things you want to keep in mind whenever you are taking care of dentures is that you don't damage them because they're very expensive, and they don't become lost because you have a lot of people going in and out of the patient's room. The patient's sick. They're not really keeping track of where their dentures are. So as a nurse, you'll want to keep them secured. So first, what you want to do is you want to gather your supplies, which will include a denture cup, which you'll want to put a patient label on the denture cup, on the lid, or write the patient's name, the room number, so they don't get confused with any other person's dentures. Also, a soft bristle toothbrush with cleaning paste for the dentures. It's really recommended that you use a denture cleaning paste instead of toothpaste because that can be abrasive to the dentures. A kidney basin, towels, paper towels, and gloves. And also be sure that you ask the patient if they brought any of their denture cleaning supplies, because some patients may prefer that you use their supplies. Then you'll want to perform hand hygiene and don gloves, and then assist the patient with removing their dentures. So our patients remove their dentures, and we've put them in the denture cup with the lid on it, and we've doffed our gloves and performed hand hygiene. And now we're at the sink area. So first, what I like to do is I like to prep my sink area because I don't want any of my supplies to become contaminated. So since we're going to be turning the faucet on and off a lot, we're going to put some extra paper towels there so we can just not contaminate our gloves, and we can use the towel to turn it on and off. Then we're going to lay down a towel in this area to help protect our supplies. So let me be doing that. And just lay it down nice and neat. And what we're going to put on it is our toothbrush with our bristles up, our cleaning paste, some extra paper towels to dry the basin out with, our basin, of course our dentures and our denture cup, and our gloves. Then we're going to prep the inside of the sink. This is really one of the most important steps you want to take when you are cleaning dentures. And what we're going to do is we're going to create this like cushion in the bottom of the sink, because just in case if you drop the dentures, and let me tell you, from cleaning lots of dentures, they become slippery and they can easily fall out of your hand. So what we're going to do is we're going to just lay these towels down in the sink, and then we're going to turn on our water. But first, let's pull the stopper and then just fill it up halfway with water. And again, this just provides a nice cushion just in case those dentures were to fall into the sink. Okay, and it's about halfway, so we're going to go ahead and turn the water off. Now we're going to prep our toothbrush. And again, you want to use like a soft bristled toothbrush, or check with your patient or your supplies and see if you have a denture cleaning brush, which is specifically made for cleaning dentures. And we're going to use some cleaning paste. And I know a lot of hospitals, you may only have access to regular toothpaste. You can use that, but just keep in mind that regular toothpaste can be abrasive to the dentures if they have whiteners in them. But we're going to use a cleaning paste, and we're going to put it on our toothbrush, just like how you normally would your own toothbrush at home. And put the cap back on the toothpaste. And set our brush down for a second while we get everything else prepped. Now we're ready to clean the dentures. So what we're going to do is I'm just going to rearrange the supplies just here a little bit. That up here and put our basin here. And what we're going to do is we're going to don our gloves, because anytime you are touching dentures, you need to always wear gloves to protect you from getting any germs from the dentures, because the mouth has a lot of bacteria in it. And we're going to turn our water on warm. We don't want it hot because it can damage the dentures, and we don't want it too cold because it really won't do the job. So we're going to turn our water on warm. And we're going to get our dentures. And what we want to do first is we're going to rinse them off. We're going to put them in the kidney basin because we want to clean this denture cup so we'll have a nice clean area for the dentures to be returned to. So grab your dentures and hold them firmly, and then just rinse them. Put them in the kidney basin. Do the other set. Rinse them off in the kidney basin. Now we're going to rinse our denture cup. And notice how dirty it gets. You want to make sure you get all that out of there. because we're going to fill it a little bit up with water, just enough water to cover the dentures. And why do we want to do that? Well, we want to do that so the dentures are kept moist, because it'll be easier for the patient to put them back in, and it'll help them keep their shape. Now, you always want to ask the patient what they use to soak their dentures in, because some patients use half of a solution, like half vinegar and half water, or a tablet solution. So always ask them that. Now what we want to do is we're going to start cleaning the dentures. So we're going to get our toothbrush, and we're going to start inward and work our way outward. And see, rinsing helped remove a lot of that, but you have to watch out, because down in the gum line, you will get a lot of paste, because a lot of patients use paste on their dentures, and food particles, and that's just a nasty reservoir for germs and bacteria to get in. So make sure you really clean that area very good. And then looking at the front of the teeth as well, getting that, because food particles like to get in there, and no one wants anything in their teeth whenever they put their teeth back in. So you want them nice and clean. And then flip them over and get up where the palate part would be as well. Okay, and then we're going to rinse those. And once you get them nice and rinsed, we put them in your denture cup. Now we're going to clean our bottoms. And again, we're going to follow the same way we did with the other ones. Clean inside that gum line really good. And make sure all the bacteria and food particles and everything's removed. And brush on the back teeth and the front teeth, molars, just like how you would brush your natural teeth. Getting inside where the tongue would lay. And then rinse. And then return to your denture cup, which has water in it. And we'll put the lid back on the cup. Now what we're going to do is we're going to rinse our toothbrush and our basin. Get that cleaned. And we're going to get the toothbrush and really rub your finger, your glove finger, over that toothbrush to get all the food particles out and the toothpaste out. Get it nice and clean. And then I like to take a paper towel and just dry that basin out. Get that toothbrush dried as well, and just put that back in there. And then turn your water off. Don't forget to pull the stopper. And let the water drain out, and then we'll take our towels once all the water's drained out and put it in the linen, and we're going to doff our gloves and perform hand hygiene. And then when you're done, don't forget to provide oral care to your patient and assist them with putting their dentures back in if they choose to. Okay, so that wraps up how to clean dentures.
Okay, so naintindihan niyo ba kung paano maglinis ng dentures? Sino ang hindi pa naka-oral recitation? Can I have your insights and learning with regards to the video that you have watched? Yes, Miss Giselle. Yes, yes. You can speak now.
Madungog po.
Yes, yes. You're audible.
Pwede Bisaya po, ma'am.
Okay.
Video is, kailangan dyan siya ang pagsundan siya thoroughly. Kay, if ever nga na ay kuan dito kay, it can affect kapag ka magputang nasa balik ang dentures dito sa baba sa kantong patient po. So, kailangan dyan sa mga kasulok-sulukan sa dentures is kailangan dyan siya ma-brush yung and then siya po.
So, medyo choppy ka, no? Hindi masyado marinig ang iyong voice. So you can type it in the chat box na lang, Miss Giselle, okay? Para makita natin kung ano yung insights and learnings. Type mo na lang sa chat box. Kasi hindi ko talaga maano yung voice mo marinig na mabuti. Okay? Sino pang iba na hindi oral recitation? Yes, Miss Mulihon.
Yes, ma'am.
What are your
Insights po, ma'am.
insights and learning? Yes, insights and learning regarding our discussion or sa video.
Like that, like sa natural teeth, ma'am, ang dentures po, medyo siya kanang i-brush daily o kanang like proper cleaning good ma'am para ma-remove tong bacteria. Dili kay like dentures lang, dili siya natural teeth, dili nimo siya tarungon og brush.
Okay. Sige, thank you. So, meron pa tayong isang video na gusto ko na panoorin ninyo. How to care for the oral health of the baby. Okay, sandali ha.
Ako po si Dr. Trina Flor Cruz at nandito ulit tayo sa isang episode ng Baby Talk. Pag-uusapan po natin ang tungkol sa pangangalaga sa mga gilagid at ngipin ni baby. Importante po na habang maaga, masimulan po natin ang good oral hygiene dahil ito po magiging foundation niya sa pag-develop ng kanyang ngipin at ganun din po para maiwasan po natin ang pag-develop ng mga dental caries o ang pagkabulok ng ngipin. Narito po ang ilan sa mga bagay na pwede natin gamitin sa panglinis ng bibig ni baby. Para po sa mga sanggol na maliliit, pwede po tayong kumuha ng malinis na gasa na binasa ng malinis na tubig. Sa mga bata naman na may kaunti ng ngipin or milk teeth, meron po tayong nabibili sa grocery or sa mga drugstore ng silicone na toothbrush tulad nito. Ito po ay may soft na bristles na pwede po natin gamitin sa milk teeth. Kasama po ulit natin ngayon si Mommy Sol at si Baby Mia. Si Baby Mia po ay wala pa pong ngipin. Kung kaya, ang gagamitin po natin ay ang gasa na binasa ng malinis na tubig. Bago po magsimula, siguraduhin po natin na naghugas tayo ng kamay gamit ang tubig at ang sabon. Pagkatapos po, kukunin lang po natin ang gasa tulad nito at ibabadot lang natin sa ating isang daliri. Pagkatapos po nito, ilalapit lang po natin yung gasa papunta sa gilagid na nasa labasan lang po. At pagkatapos po, iwa-wipe lang po natin siya unti-unti. Siguraduhin po natin na hindi po masyadong madiin ang ating pagwa-wipe para hindi po magalusan ng gilagid ni baby. Pagkatapos po, gagawin po natin ito umaga at hapon dahil pwede pong may mga gatas or residue ng pagkain na naiiwan sa bibig ni baby na pwedeng mag-cause ng infection or pag-growth ng mikrobyo. Muli, ako po si Dr. Trina Flor Cruz para sa Baby Talk.
Okay, so ganun ang paglinis. Meron pala yung parang goma siya, di ba, na mabili daw sa pharmacy or sa store, no, for children na merong, mga bata na merong, infants na meron ng, kailan yun siya gagamitin? Na meron ng ngipin, may natubo na ng ngipin na maliit. Yes. Okay, so nag-message na si Miss Kisel. Okay. Di ma-cause ng discomfort sa patient. So, thank you, Ms. Giselle. So, sino pang iba? You may share your learnings and insight regarding our discussions. Yung hindi pa naka-oral recitation. Yes, Mr. De La Serna.
Ma'am, about sa video, ma'am, yung sa baby, ma'am.
Whether sa video or any part of our discussion, your learnings.
Nakita ko sa video sa yung sa pag alaga sa ngipin ng baby, ma'am, is dapat careful po tayo, ma'am, kasi madali pong ang tawag dapat kasi madaling masira yung gums nila, yung dapat soft na bristles gamitin kasi yung gums ng baby is iba sa gums ng adults. And yun po ma'am, kailangan po din ng regular natin sila nilinis para iwas din po sa cavities po ma'am, yung bacteria po.
Okay, thank you, Mr. De La Serna. Madaling masugatan, no? Sensitive pa yung kanilang gums. So, careful daw sa paglinis sa gilagid ng bata. Okay, thank you. Who else? Sino pa ba na hindi pa naka-oral recitation? Wala pong. Jaya. Nag-answer na pala. Okay, sino pang iba? Mr. Ko, nag-answer na ba to si Mr. Ko? Okay, he's not around. Nawala siya. Okay, anyway, so that ends our discussion for today. Thank you for listening. So, ang reference na ginamit ko is sa kay Kujir, no? 2022 na reference, Fundamentals of Nursing. Okay? So, tomorrow, we're going to discuss about the procedure checklist on assisting the client in oral hygiene. Okay, ito yung gagawa ninyo ng return demonstration. Since tapos na tayo lahat sa lecture natin, so ito na lang yung mga kulang natin, no, yung mga ating mga RD. We're done with the open gloving and the hand washing now. Tomorrow we'll be discussing about the oral hygiene. Okay, yung step-by-step process. Isa-isahin natin to en rationale. No? Like ano yung ginawa natin before sa ating RD, like demo ng
may
open
patient
gloving and
anak
hand
ma'am.
washing. Okay, so I will post the lecture slides sa inyong LMS para may study guide kayo. And also ito din. So see you again tomorrow, class. Thank you for attending and participating. Yes, kailangan may patient kayo nito. Okay, ang inyong return demo. Okay, do you have any questions regarding our... wala ako. Wala akong internet. Hello? Wait lang ha. Can you hear me? Pero hindi ko kayo makita.
Yes, ma'am.
Ayan na. Sige, off ko na lang ang aking cam. Okay, so any questions regarding our discussion? Yeah. So, we'll discuss that one tomorrow. Okay? So, pero kailangan pa rin may actual patient kayo kasi i-demo ninyo. How will you learn, no? How to clean the patient's mouth kung wala talaga kayong actual patient. So, dito naman kasi sa ating checklist is meron tayong independent client, yung kaya lang ng pasyente na ilinisan, so we'll just have to assist them, no, how they will clean their mouth or their oral cavity. And we have the dependent client. This is very important, step-by-step process. Kasi baka in the future, no, maka-duty kayo sa ICU, at least you know how to care, no, to clean their oral cavity. Okay, dependent. What do you mean by dependent? Patients who are needing assistance, like patients who are in the ICU, who are comatose, unconscious, stroke patients, di ba? So we have two types, independent client and the dependent client. So we'll discuss that tomorrow. We'll discuss it step by step. Okay, so I require you to have a patient talaga. Okay, do you have any questions, clarifications, violent reactions before we end?
Ma'am,
Yes.
permission to ask po, ma'am. With regards po sa exam, ma'am, baka exam week, mangud karon, ma'am. Wala mi i-take karon na week, ma'am.
Next week na ating exam kasi ongoing pa yung aming next week ang exam sa lecture and RLE.
Okay po, ma'am. Thank you po.
Okay. So, wala na. So, kindly turn on your cameras kasi mag-take tayo ng picture. Miss Salva, can you take a screenshot? Now, if everybody, kindly turn on your cam. Okay, mag-smile na tayo and all. Sige. Sige lang, first and second, ano lang. Okay, thank you. Kindly send it sa ating GC. So if you don't have any questions, so mag-adjourn na tayo. We'll meet tomorrow again. Okay?
Okay, ma'am. Bye po.
Thank you. Thank you for listening. Thank you for
Bye-bye.
participating.
Thank you.
Bye.
Thank you, ma'am.
Thank you,
Okay,
class.
bye-bye.
Thank you, Ma'am Patty.
Thank you po.
Thank
Thank
you,
you.
sir.
Sir, thank you po, sir.
Okay, bye-bye.
Thank you, sir.
Thank you, sir.
Thank
Thank
you,
you, ma'am.
Dean. Thank
You're
you, sir.
welcome.